Welcome to our channel. Today in this video, we're diving into real practice questions, breaking down the right answers, and clearing up the wrong ones so you walk into test day with confidence. Without further ado, let's start with question number 1. Question number 1. A child starts screaming when asked to clean up toys. The teacher then removes the demand. What is the likely function of this behavior? A. Positive reinforcement. B. Negative punishment. C. Escape. D. Automatic reinforcement. The correct answer is C. Here's the deal. The behavior, screaming, results in the demand being taken away. That's a textbook example of escape-maintained behavior. The child screams to get out of the task, and it works. Now for the wrong answers. A is about adding something the child likes. Not happening here. B is punishment. But again, nothing's being taken away as a consequence for bad behavior. And D, automatic reinforcement is when a behavior feels good all by itself, like hand flapping. Not the case here. So, remember that if a demand goes away after the behavior, think escape. Question number 2. When teaching toothbrushing, the child is taught each step in sequence, picking up the brush, applying toothpaste, brushing. This strategy is known as A. Backward chaining. B. Forward chaining. C. Total task chaining. D. Task analysis. The correct answer is B. Basically, forward chaining teaches one step at a time, starting from the first. You move forward as each step is mastered. Now for the wrong answers. A is backward chaining, which starts with the last step first. C is teaching the whole task at once. Helpful in some cases, but not what's described here. And D, task analysis, is more about breaking the task into steps before choosing your teaching method. Remember each strategy and differentiate them clearly to select precisely. Question number 3. A child earns a token after each completed math problem. This is an example of A. Negative reinforcement. B. Token economy. C. Response cost. D. Prompt fading. The correct answer is B. This is a classic token economy. The child gets tokens, a kind of fake money, for doing the right thing. And they can trade those tokens for real rewards later. Now for the wrong answers. A is not it. There's no removal of an aversive stimulus. C is about taking something away as punishment. And option D, that's all about gradually reducing prompts, not rewards. So, token economy equals earn now, spend later. Question number 4. When reinforcement is removed and the behavior temporarily increases before decreasing. This is called A. Extinction burst. B. Spontaneous recovery. C. Generalization. D. Latency. The correct answer is A. Here's what happens. You stop reinforcing a behavior, and the behavior gets worse before it gets better. That spike is called an extinction burst. Now for the wrong answers. B is spontaneous recovery, which is when the behavior shows up again after extinction. C is when a behavior transfers across settings or people. And D measures the time between instruction and response. Not relevant here. So that big behavioral flare-up, that's your extinction burst. All right, let's move on to question number 5. Question number 5. A child is praised and given a reward every 5 minutes if they do not scream. What strategy is being used? A. DRO. B. DRA. C. DRE. D. Response blocking. The correct answer is A. DRO stands for differential reinforcement of other behavior. Basically, you reward the child for not doing the problem behavior. In this case, screaming. Now for the wrong answers. B is reinforcing an alternative behavior, like using words instead of screaming. C is reinforcing an incompatible behavior, like humming or whispering, which can't happen at the same time as screaming. And option D, that's physically stopping the behavior, not what's going on here. So when the goal is to reward, not doing the behavior, DRO is your answer to select. Question number 6. A child is asked to choose a preferred snack between two options. This type of preference assessment is A. Free operant. B. Single stimulus. C. Paired stimulus. D. MSU. The correct answer is C. Paired stimulus means presenting two items at a time and asking the child to choose. By doing this across multiple trials, we find out what the child prefers based on repeated choices. Now for the wrong answers. A is free operant, where all items are available at once and the child interacts freely. B shows only one item at a time, which doesn't involve making a choice. And D, MSU, involves more than two items and removing the selected one each time. If you're showing two items and seeing which one gets picked, that's a paired stimulus assessment. Question number 7. A child is prompted by having their hand guided to the correct picture after an incorrect response. This prompt is A. Partial physical, B. Fully physical, C. Gestural, D. Model. The correct answer is B. Full physical prompting means hand-over-hand assistance to guide the child through the entire action. In this case, moving their hand directly to the right picture. Now for the wrong answers. A is partial physical, which might be a light touch or nudge. C is gestural, like pointing to the correct item. D is modeling, which means demonstrating the correct action, so if you're guiding the whole movement, it's fully physical. Question number 8. An RBT records the time from a demand to the child's response. This is called A. Duration, B. Latency, C. Inter-response time, D. Frequency. The correct answer is B. Latency is how long it takes for a child to begin a response after a demand is given. If you say sit down and they start moving after 4 seconds, that's a 4-second latency. Now for the wrong answers. A is duration, which tells you how long the behavior lasts. C. Inter-response time is the time between two behaviors. D is frequency, which just counts how often the behavior happens. The key takeaway from this question is, if you're timing the delay between instruction and action, that's latency. Question number 9. The RBT observes behavior only at the end of each 1-minute interval. This is A. Partial interval, B. Whole interval, C. Momentary time sampling, D. Frequency recording. The correct answer is C. Momentary time sampling means checking if the behavior is happening right at the end of a time interval. It's like taking a snapshot at a specific moment. Now for the wrong answers. A is a partial interval, where you record if the behavior occurred at any point in the interval. Option B is the whole interval, where the behavior must happen during the entire interval. And D is frequency, which counts every instance of the behavior. If you're only looking at the end of the interval, that's momentary time sampling. Question number 10. A child says, I want to play, and the RBT gives the toy. This is an example of A. Echoic training, B. Tact training, C. Functional communication training FCT, D. Intraverbal. The correct answer is C. FCT, or Functional Communication Training. Teaches kids to use appropriate communication instead of problem behavior. In this case, the child asks for a toy and gets it. That's an appropriate requesting. Now for the wrong answers. A is not correct, which is repeating what someone else says. B is tacting, like labeling something you see. D is intraverbal, which involves answering questions or having a conversation. You have to remember when a child learns to ask for what they want in a functional way. That's FCT. Question number 11. A student bangs the desk to escape writing tasks. The RBT gives breaks only when tasks are completed without desk banging. This is A. DRA, B. DRO, C. NCR, D. Punishment. The correct answer is A. DRA stands for Differential Reinforcement of Alternative Behavior. The student is being reinforced for completing the task without banging, which is an alternative, appropriate behavior. Now for the wrong answers. B is DRO, which reinforces the absence of a behavior. Not quite the same. C is NCR, which provides reinforcement on a time-based schedule. unrelated to behavior. And D, punishment would involve decreasing behavior through a consequence, not rewarding better behavior. So when you're reinforcing a more acceptable behavior that serves the same purpose. That's DRA. Question number 12. A child is reinforced after every 5 correct responses. This reinforcement schedule is A. V5, B. FR5, C. VR5, D. Phi-Phi. The correct answer is B. FR stands for fixed ratio. FR5 means the child gets reinforcement after every 5 correct responses. It's predictable and consistent. Now for the wrong answers. A is variable interval, based on time, not number of responses. C is variable ratio, which changes the number of responses needed. D is fixed interval, also time-based. So if it's every 5 responses, no matter what, it's FR5. Question number 13. An RBT suspects a child is being abused. The RBT should A. Monitor the situation longer. B. Immediately report to the supervising BCBA. C. Ask the parents directly. D. Wait for evidence. The correct answer is B. As a mandated reporter, an RBT must report any suspicions of abuse right away to the supervisor or proper authority. You don't wait or investigate on your own. Now for the wrong answers. A is risky, because waiting could endanger the child. C puts you in a tricky legal and ethical spot. D sounds careful but delays action. When you are in doubt, report it to your BCBA immediately. Question number 14. Which of the following should not be included in a session note? A. Duration of behavior. B. Personal opinions about the client. C. Objective behavioral observations. D. Direct quote from a behavior. The correct answer is B. Session notes should be objective and measurable. Personal opinions, like saying the child was being difficult or lazy, don't belong in professional documentation. Now for the wrong answers. Option A is valid data included in a session note. C with the answer. Objective behavioral observations is exactly what an RBT has to note down during the therapy session. And direct quote from a behavior in option D can be useful if it's behaviorally relevant. So remember, keep your notes clear and fact-based. Question number 15. When describing a behavior like screaming, which is the best example? A. The child was annoying. B. The child screamed loudly for more than 5 seconds. C. The child seemed upset. D. The child was in a bad mood. The correct answer is B. This is the only option that's measurable and observable. It tells you what the behavior looked like and how long it lasted. Now for the wrong answers. Option A, C, and D are all subjective. They involve guessing feelings or attitudes, and a takeaway is that if you're describing behavior, always go with something concrete and observable like option B. Question number 16. What is the definition of frequency? A. Total time a behavior occurs. B. Number of times a behavior occurs. C. Time between behaviors. D. Behavior per minute. The correct answer is B. Frequency simply means counting how many times a behavior happens. It's one of the most straightforward ways to track behavior, especially when you're dealing with discrete, countable actions, for example, like hitting, raising a hand, or saying a specific word. Now for the wrong answers. A is incorrect because it defines duration, which measures how long the behavior lasts, not how often it happens. C refers to inter-response time, which is the time between 2 separate instances of a behavior. D refers to rate, which involves frequency, but adds a time element like behaviors per minute. If you're just keeping count of how many times something happens, that's frequency. Question number 17. What does DRO stand for? A. Differential reinforcement of other behavior. B. Direct response observation. C. Delayed reinforcement output. D. Decreasing repetitive output. The correct answer is A. DRO is a strategy where you reinforce any behavior other than the undesired one within a specific time period. For example, If a child typically engages in head banging, and you reinforce them for every minute that goes by without the head banging, that's DRO. It encourages the absence of the problem behavior rather than teaching a specific replacement. Now for the wrong answers. B. Direct response observation. Sounds behavior-related but is not a real ABA term. C. Delayed reinforcement output. Is made up and doesn't refer to any actual behavioral strategy. D. Decreasing repetitive output. Also isn't a recognized term in ABA. So when you want to reward the absence of a problem behavior, DRO is the go-to method. Question number 18. When reinforcement is withheld for a previously reinforced behavior, this is called A. Fading, B. Extinction, C. Reinforcement, D. Generalization. The correct answer is B. Extinction means you stop giving reinforcement for a behavior that was previously reinforced. And over time, the behavior should decrease. For instance, if a child gets attention for tantrums, and then you stop responding to tantrums, the behavior may initially escalate extinction burst, but should eventually decrease. Now for the wrong answers. A is fading, which is gradually reducing the level of prompts or assistance. C is the act of providing reinforcement, which increases a behavior, not withholding it. D is generalization, which refers to transferring learned behavior across settings, people, or stimuli. So when reinforcement is stopped to reduce a behavior, it's called extinction. Question number 19. Amend is A. A response to a question. B. A request driven by motivation. C. A label of an object. D. Repeating a word heard. The correct answer is B. Amend is a type of verbal behavior where the speaker asks for what they want or need. It's controlled by a motivating operation. For example, hunger and reinforced by getting the item or action requested, like asking for food. Now for the wrong answers. A describes an intraverbal, which is responding to another person's question or comment. C is attacked, which involves labeling things in the environment, like saying car when you see a car. D is echoic, where the person repeats exactly what they hear, so note down when motivation drives the request. It's called amend. Question number 20. The main purpose of behavior data collection is A. To impress insurance reviewers. B. To track client progress and inform treatment. C. To satisfy parent curiosity. D. For administrative reports. The correct answer is B. Collecting data helps RBTs and BCBAs make informed decisions about client treatment. It shows what's working, what's not, and whether behaviors are improving, worsening, or staying the same. Without data, there's no way to measure progress or effectiveness. Now for the wrong answers. A might happen as a byproduct, but it's definitely not the goal. C might seem reasonable, but data must always be collected for clinical, not casual, reasons. D is partially true. Data is often part of documentation, but it's not the primary reason for collecting it. So if you're trying to make real change, reliable data is essential. Question number 21. What is latency? A. Time between behaviors. B. Time from response to reinforcement. C. Time from SD to response. D. Total time of behavior. The correct answer is C. Latency refers to the time between when an instruction or cue, called a discriminative stimulus, or SD, is given, and when the behavior actually begins. For example, if you say stand up and the child stands up 3 seconds later, that's a 3-second latency. Now for the wrong answers. A is inter-response time, which measures the time between two behaviors, not the time between a cue and a behavior. B focuses on the time after the behavior ends, not before it begins. D is duration, which tracks how long the behavior lasts. Therefore, if you're measuring how long it takes to get started after an instruction, you're measuring latency. Question number 22. According to the Ethics Code, RBTs must A. Follow only parent instructions. B. Maintain client dignity and privacy. C. Report data only if asked. D. Discuss client cases with friends. The correct answer is B. RBTs are bound by an ethics code that requires them to protect client dignity and confidentiality at all times. That means no gossip, no sharing client info with people who aren't authorized, and always showing respect for the client. Now for the wrong answers. A is risky because RBTs follow the treatment plan developed by the BCBA, not just what parents say. C is incorrect because RBTs must collect and report data as part of their job, not just when asked. Option D is a serious breach of ethics and confidentiality when sharing client information with your friends. So for professional, ethical behavior, protecting privacy and dignity is key. Question number 23. Stimulus control occurs when A. A behavior is triggered randomly. B. A specific SD reliably evokes a behavior. C. The behavior is automatic. D. A reinforcer is presented. The correct answer is B. Stimulus control means a specific cue, or SD, leads to a certain behavior, because that behavior has been consistently reinforced in its presence. For instance, if a child always washes their hands after seeing the bathroom sign, that sign has stimulus control over the behavior. Now for the wrong answers. A. There's no pattern or control, which is not what we want. C is more about automatic reinforcement, not SDs. D happens after the behavior, not before it. Remember that a stimulus predicts behavior because of history with reinforcement. That's stimulus control. Question number 24. Prompt fading helps A. Maintain reliance on assistance. B. Transfer control from prompts to SDs. C. Punish incorrect behavior. D. Eliminate reinforcement. The correct answer is B. Prompt fading is all about gradually reducing the level of help so the child can respond independently to the SD. For example, moving from hand over hand to just a gesture, and then no prompt at all. Now for the wrong answers. A is the opposite of what we want, since we want independence. C is unrelated because punishment reduces behavior, not promotes independence. D is not related to prompting at all. So in the situation that we want the SD alone to control the behavior, we fade out the prompts. Question number 25. An example of generalization is A. Child labels both a photo and real cat as cat. B. Child only responds to one picture. C. Child needs prompts every time. D. Child refuses to respond. The correct answer is A. Generalization means the behavior occurs in different environments, with different people, or across different stimuli. If a child learns to say cat when they see a real cat, and also says it when seeing a cartoon or photo, that's a generalization. Now for the wrong answers. B is limited to one stimulus, showing a lack of generalization. C shows prompt dependency, not generalization. D shows a failure to engage, not successful generalization. So note that behavior transfers to new situations or things. That's generalization. Question number 26. Automatic reinforcement refers to A. Behavior maintained by another person's response. B. Behavior that produces its own reinforcement. C. Attention-seeking behavior. D. Reinforcement after meals. The correct answer is B. Automatic reinforcement happens when the behavior itself creates a satisfying consequence without needing another person. For example, a child might hum, rock, or hand flap because it feels good or helps regulate their sensory needs. No one else has to provide a reward. It comes from within. Now for the wrong answers. A describes socially mediated reinforcement, which is not automatic. C might involve attention, but attention is provided by others, so it is also not automatic. D is unrelated and has nothing to do with behavior functions. Question number 27. Teaching a child to label objects like dog or ball is teaching A. Men, B. Tact, C. Echoic, D. Intraverbal. The correct answer is B. Tacting is labeling things in the environment. If a child sees a ball and says ball, they are tacting. It is under the control of nonverbal stimuli, like visual or auditory cues. Now for the wrong answers. A is manding, which involves requests based on wants or needs. C is echoic, which is repeating exactly what someone else says. D is intraverbal, which is conversational, like answering a question. Remember that when it comes to the phrase labeling things, that is tact training. Question number 28. Which of the following violates ethical RBT conduct? A. Honest data reporting. B. Sharing client photos on social media. C. Accepting feedback from supervisors. D. Asking for clarification from BCBA. The correct answer is B. Sharing any client information, especially photos, on social media is a serious breach of confidentiality and a violation of the RBT Ethics Code. Protecting client privacy is a top priority in all settings. Now for the wrong answers. A is actually required. Data must be accurate and honest. C is part of ongoing professional development. D is encouraged. RBTs should always seek clarification when unsure. So sharing client information online is absolutely not ethical when doing therapy with a client as an RBT. Question number 29. When a client demonstrates a skill across multiple people and environments, this is A. Discrimination. B. Generalization. C. Prompt fading. D. Shaping. The correct answer is B. Generalization means the learned behavior carries over to different settings, people, or stimuli. If a child learns to greet their teacher and also greets peers or family members, that is generalization. Now for the wrong answers. A is the ability to tell the difference between stimuli, not transferring behavior. C is about reducing prompts, not applying skills across contexts. D is shaping, which involves building up to a behavior, not expanding its use. Therefore, generalization means using what you have learned in real-world situations. Question number 30. An example of shaping is A. Reinforcing a child for gradually sitting closer to a chair, then eventually sitting. B. Giving a reward every 5 responses. C. Teaching the child to echo sounds. D. Fading out prompts. The correct answer is A. Shaping involves reinforcing successive approximations toward a final behavior. You start small, like rewarding a child for moving toward a chair, and slowly increase the expectation until the full behavior is performed. Let's look over the wrong option. Option B is a reinforcement schedule, not about shaping. C is about echoic training, so not a shaping process. And D is prompt fading because you can see the term prompts. This prompt fading is about reducing help, not building new behavior. So if you are building up to a behavior step by step, that is shaping. And that's it for today's RBT practice session. Head over to our website where you can access even more free RBT test questions. If you found this helpful, make sure to like the video and subscribe for more exam prep. And we will see you in the next video.